blood bank technology, medical record, and a secure parking. Supported by the implementation of a top vocational education with 60% of practicum activities and 40% of theory study, which will improve the student's skill with practice in laboratories and other practical media. Polkesma continue to implement innovative, fun teaching methods with the concept of enjoying learning. On top of that, Polkesma implements an internet-based test for examination and e-learning and blended learning, which is applying classroom learning methods and utilizing e-learning. A qualified education is formed by instilling values that are presented through 220 teaching staff, qualified master and doctorals who have been certified with various disciplines and examples in daily life. Polkesma also instills national character and ethics and excels in professionalism to withstand the global challenges. Besides academics, Polkesma also prepares students who are confident in their abilities by providing student activity units, developing students' interests and talents ranging from arts, sports, science, Red Cross, Scout, language, and spirituality. This is where the step of realizing the ideal begins, by channeling freedom of expression. Polkesma educates students to be loyal to the country and have a mental attitude of character by providing an education of national defense. Polkesma shows success in producing superior individuals with both national and international achievements. National and international cooperation with the health education institution as well as the health service institutions. This success can also be seen from the distribution and role of Polkesma alumni in international health agencies, spread across Asia, Australia, Europe, and even America.
Oh, well, that's the profile about Poltekkes Kemenkes Malang, Miss Mazriana. I hope you can have a big portrait about me.
Yeah, too big, huh? Your campus.
Yes.
I'm very impressed.
That's really good. That's really true.
Yeah,
Thank
really
you.
good.
Thank you very much, Miss Mazriana.
How about UTM? UTM, how many camp do you have?
UITM actually have about 15 campus all around the Malaysia. Yeah. Almost every state we have a campus, a branch campus.
State is similar with province?
Yes. Yeah. Because every state we have the main branch campus. And some state have a branch and a branch. That's mean 2 branch like that.
State is mean negara bagian. State
what?
is negara bagian like that. Negara bagian. State.
Negara. Yes. Negeri.
Negeri. Oh, negeri.
Yeah.
You call negeri. Okay.
Negeri. Yeah.
Yeah.
How many lecturers do you have in Malang?
Oh, my lecture about 300.
Wow.
300 lectures.
Ramai, ramai.
Ramai.
Yeah.
Banyak, banyak ramai.
Yeah, banyak, banyak.
Yeah.
Yeah, kami we call it as
Ramai means
ramai.
banyak.
Iya.
Yeah, banyak.
Many.
Same. So are we waiting student to come in?
I think we can start our guest lecture right now, ma'am. Is it
We can start, right? Okay,
okay?
let me share my screen first, yeah?
Excuse
We
me, ma'am.
opening
I
this.
think there will be an opening ceremony first, and then
Oh,
after
okay.
that, we will welcome you. We will invite
Okay.
you as the
Alright. Okay.
guest lecturer today. Thank you very much, Miss Madriana.
Please pay attention to all the participants. First, rename your screen name, like the example, class underscore name, and don't forget to fill out the form of attendance list distributed at the end of the session. Thank you so much. Please pay attention to all the participants. First, rename your screen name, like the example, class underscore name, and don't forget to fill out the form of the attendance list distributed at the end of the session. Thank you. Excuse me, Bapak, Ibu, and all the participants, allow me to start the guest lecture today. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I am Renata Eka Febrianti. Would like to say welcome to the guest lecture of Program Studi D3 Keperawatan Trenggalek. Ladies and gentlemen, the next singing national anthem Indonesia Raya and hymne Poltekkes Kemenkes Malang. Please sit up straight. Thank you for the all participants. Our respect and honor are delivered to Mrs. Masriana binti MD Kasim MN. We would like to welcome you to the program studi D3 Keperawatan Trenggalek, Malang State Health Polytechnic, East Java, Indonesia, and we're looking forward to hearing your insightful sharing regarding the nursing science. The deepest respect is also delivered to the directors, deputy directors, head of the study program of Prodi D3 Keperawatan Trenggalek, Malang State Health Polytechnic, and all participants. First of all, the feeling of gratitude and blessing are always devoted to Allah Subhanahu wa Ta'ala, the Almighty God, who has given us his blessing that we can join a virtual international guest lecture in a good state of health. Amin, 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 ya rabbal alamin. Dear participants, today we are going to have a guest lecture with the theme Nursing Care for Stroke Patients during Rehabilitation Phase. Please sit back and relax to listen and pay attention to the distinguished speaker for a couple of hours ahead. Well, ladies and gentlemen, let's start our agenda today by saying Basmalah together. Bismillahirrahmanirrahim.
Rahim.
Thank you very much. Ladies and gentlemen, we are going to have a welcome speech from the head of studi program of Prodi D3 Keperawatan Trenggalek, Ibu Nurse Rahayu Niningasih, Eskep MKes. The time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, Bapak Ibu dosen. Selamat pagi, Pak Kisan. Good morning, tenaga kependidikan and all the students of Prodi Diplomatika Keperawatan Trenggalek. Special greeting to Miss Masriana binti MD Kasim, Magister of Nursing. Welcome to the Nursing Study Program of Trenggalek, Health Polytechnic of Malang, East Java, Indonesia.
Thank you.
Selamat pagi, salam sehat dari Indonesia.
Ya, salam dari Malaysia juga.
On behalf of the Health Polytechnic of Malang, I would like to say thank you so much for your time to share update information and knowledge with us, the students of nursing, about nursing care for stroke patients. We are really happy and looking forward to hearing your lecture. We hope that through this international guest lecture, the students will find something useful and beneficial for their studies and career. Mudah-mudahan semua yang didapat hari ini sangat bermanfaat.
Amin.
Well, you know, the Indonesian government is fighting against non-infectious diseases. One of them is stroke. Ini salah satu alasan kenapa kami mengambil tema tentang stroke. Through the application of aplikasi Sehat Indonesiaku, in short ASIK, healthcare providers record the data of non-infectious diseases, so the government can decide the policy dealing with the problems. In addition, we have one technique to recognize stroke at an early stage, namely segera ke RS, standing for senyum tidak simetris, gerak tubuhnya melemah, cara tidak lancar, kebas atau kesemutan, rabun, dan sakit kepala. This is in line with our vision to be excellent in caring for stroke patients. Sebuah kalimat yang sederhana mengajak semua masyarakat, semua orang awam untuk segera ke rumah sakit jika menemukan salah satu tanda tersebut.
Hmm.
Well, that's why we would like to know Miss Mazriana about stroke. Once again, thank you so much, and it's very nice to meet you. See you again, be happy. Semoga bermanfaat, sehat senantiasa, panjang umur, ketemu lagi dalam keadaan sehat dan bahagia.
Ya, amin, amin.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
For delivering the welcome speech. Well, all participants, we are coming to the core of the guest lecture. I would like to welcome the moderator of the international guest lecture, Ibu Yuyun Putri Mandasari, MPD, one of the lecturers of Poltekkes Kemenkes Malang. Ibu Yuyun Putri, the screen is yours.
Thank you very much, Renata. Assalamualaikum warahmatullahi wabarakatuh. Good morning, all the participants. Good morning, Ibu Rahayu Nenengasi. Good morning, Pak Kisa. I'm Yuyun Putri Mandasari on behalf of Trenggalek Nursing Study Program, Diploma 3, Health Polytechnic of Malang, East Java, Indonesia. And I would like to welcome you all to the guest lecture, international guest lecture today. And I think it's such a great honor for me to become the moderator of the outstanding and distinguished speaker of the day, Miss Mazriana binti MD Kasim, Master of Nursing from University Teknologi Mara, Malaysia. Good morning, selamat pagi Cikgu, apa kabar hari ini?
Good morning, selamat pagi. Alhamdulillah sehat.
Okay, that's really great. Thank you very much. Okay, well, before we start our guest lecture today, allow me to read your awesome curriculum vitae. Let me share the screen with you. Okay. Sorry. The operator, would you please help me to share screen? The curriculum vitae of Miss Mazriana. Well, Miss Mazriana has a wonderful working experiences since 2001, and right now she is a nursing lecturer at University Teknologi Mara, Malaysia. And for her teaching experiences, she has taught various courses in the field of nursing science. And besides that, Ms. Kasim also has many academic appointments. Some of her academic appointments are being reviewer of journal, and then the academic and exam coordinator, and also a program coordinator of nursing program, Faculty of Health Sciences, University Teknologi Mara, 2022 until 2023. And she is also a professional organization member of Malaysian Nursing Board and Malaysian Nursing Association until 2023. For her publications, Ms. Kasim has got lots of journal publication and to be invited speaker in a scientific forum. One of her latest publications regarding the effectiveness of organ donation, education on knowledge and attitude among intensive care nurses. And right now, she also has got project grant entitled Latihan Kursus Penjagaan Selepas Bersalin. Okay, well, now allow me to invite Miss Mazriana binti MD Kasim and 60 minutes ahead is yours.
Thank you very much, Miss Yuyun. Okay. Let me share first my screen, okay?
Yes, please, Miss Kasim.
Can you see my slide?
Yes, of course. It's very
Okay.
clear.
Okay, Assalamualaikum and very good morning to everyone. Okay, I think Miss Yun already introduced myself. Okay, I'm Mazriana binti Mat Kasim. I'm the program coordinator for the nursing program, Faculty of Health Sciences, UITM Pulau Pinang branch. And my academic qualification is a Master of Nursing in Critical Care from UITM Pulau Pinang, UITM. Okay, before we start, okay, let's see our topic for today is nursing care for the stroke patient during rehabilitation phase. Okay, since I think stroke is the common topic, okay, in our life, right? Because currently stroke is a condition arising in worldwide. Okay, before we start, let's see our learning. What is the stroke meaning? And then state the etiology of the stroke, state the classification of the stroke, state the type of the stroke, list the clinical manifestation of the stroke, state the diagnostic test for the stroke, explain the management of caring patient with the stroke, and lastly is describe the nursing care of patient with stroke during rehabilitation phase. Okay, as introduction, stroke is a major cause of mortality and disability in Malaysia, in many countries, including Malaysia. And in Malaysia, it shows that stroke emerged as one of the top 5 leading causes of mortality since 2000, and 7.1% of all mortalities recorded in the Malaysian population in 2017. Okay, this is from Department of Statistics Malaysia in 2017. And it is considered to be a single most common cause of severe disability. Okay, we look for the definition of the stroke. It is, according to the World Health Organization, stroke is a rapidly developing clinical signs of focal or global disturbance of cerebral function with symptoms lasting 24 hours or longer or leading to the death with no apparent cause other than vascular origin. Okay, the definitions shows that stroke is one of the focal disturbance in it's including our life. Okay, so stroke can be classified into 5, which is early hyperacute, okay, which is a stroke that is 0 to 6 hours of old. Late hyperacute 6 to 24 hours, acute 24 hours to 7 days, subacute 1 to 3 weeks, and chronic more than 3 weeks. Okay, there is a 2 type of stroke, which is ischemic stroke, okay, in which vascular occlusion and significant hypoperfusion occurs. Okay, that means there is a blockage for the blood vessel. And second one is the hemorrhage stroke, in which there is an extravasation of blood into the brain or subarachnoid space. Okay, hemorrhagic stroke means the leakage of the blood vessel into the subarachnoid or in our brain. Okay, this is how the 2 type of stroke, okay, which is ischemic stroke, mostly due to the emboli or the thrombus. But for hemorrhagic stroke, it's because of blood leakage into the brain tissue. Maybe because of the weaken of the blood vessel, causing the blood vessel to rupture. Okay, ischemic stroke occur when the artery of the brain suddenly interrupted by a thrombus, such as blood clot, embolus, such as foreign matter to the circulation, or stenosis, which is narrowing, causing severely reduced blood flow, or we call it as ischemia, and the resultant necrosis of the cell in the brain. Okay, vary according to the area of the brain involved, the size of the affected area, and the length of the time blood flow is decreased or the stop. And ischemic stroke is a major loss of the blood supply to the brain and can cause severe disability or death if not treated well. Okay, currently ischemic stroke account for 87% all stroke. The blockage may result from the blood clot either as a thrombus or emboli, or from the stenosis of the vessel resulting from the build-up of the plaque. Plaque means like emboli. Okay? And plaque may cause stenosis in the large blood vessel or small blood vessel in the brain. Okay, for the hemorrhagic stroke, okay, is a ruptured brain aneurysm or ruptured arteriovenous malformation, or we call it as AVM, or a weakened blood vessel leak that suddenly interfere with the brain functions. Okay, that's mean the tangle of the blood vessel that connect to the arteries and vein to the brain. And blood spill into the around the brain and create swelling and pressure, damaging cells and brain tissue. And currently, hemorrhagic stroke account for about 15 to 20 of the cerebrovascular disorders and primarily caused by intracranial or subarachnoid hemorrhage and caused by bleeding into the brain tissue, ventricles, or the subarachnoid space. Okay, so the hemorrhagic hemorrhagic stroke, okay, can be divided into the intracerebral hemorrhage, and normally for this disease can occur in the adult and subarachnoid hemorrhage for the young people. Can I proceed? Okay, for the hemorrhage stroke, which is we have intracerebral hemorrhage, okay, which is bleeding into the brain tissue and very common in the patient with the hypertension and cerebral atherosclerosis. And because degenerative changes from this disease cause rupture of blood vessel. And for the subarachnoid hemorrhage, okay, subarachnoid hemorrhage result from the ruptured intracranial aneurysm, or we call it as a weakening in the arterial wall. Okay, this is the intracerebral hemorrhage. As we can see, there is a rupture of the blood vessel in the brain. Okay, and intracerebral hematoma is an accumulation of the blood. When the blood rupture and then it accumulates in the blood inside the brain and caused by the rupture of the blood vessels. Okay, this is a subarachnoid hemorrhage. Okay, you can see the part of the subarachnoid, okay, has bleeding. Okay. Okay, the etiology of the stroke is first hypertension. This is the main factor, okay, causing stroke for the patients. And then diabetes mellitus, hyperlipidemia. Hyperlipidemia will causing atherosclerosis for the blood vessel. And then alcohol abuse and smoking can trigger the arterial fibrillation, which is can cause the blood clot to form in the heart. Okay. And then another etiology is a previous stroke, sedentary life, and obesity. Okay, clinical manifestation. Majority of the patient with the stroke will come with this sign and symptoms such as numbness or weakness of the face, arm or leg, especially on the side of the body, one side of the body. Confusion or change in the mental status, trouble speaking or understanding speech, visual disturbance, difficulty walking, dizziness or loss of balance coordination, and sudden severe headaches. Okay, this is the main sign and symptom for the patient with the stroke. But there is a neurological deficit of the stroke, which is come with the manifestation such as there is a visual field deficit such as hemoptysis, hemianopsis, which is loss of the half of the visual field. And the manifestation patient with this symptom is unaware of person, object or site of visual loss, neglect of one side of the body and difficulty judging distances. That means it cannot anggarkan how far that the distance. And then loss of peripheral vision, such as difficulty seeing at night, unaware of object or border of object. And patient might come with the diplopia, such as double vision. For the motor deficit, patient might having hemiparesis, which is weakness of the left or right half of the body. And flaccidity, such as absence of muscle tone, which is we call it as a hypotonia, and the spasticity. Another symptom such as hemiplegia, which is paralysis of the left or right half of the body. Another motor deficit is ataxia, which is staggering or unsteady gait. Okay? Patient unable to balance their weight. Okay? And unable to keep feet together, need to a broad base to stand. Dysarthria is a difficulty in forming words, and dysphagia is a difficulty in swallowing. For the sensory deficit, patient might come with the paresthesia, which is occur on the side opposite of the lesion. There's manifestations such as numbness and tingling of the extremity, difficulty with the proprioception. And for the verbal deficit, patient will come with a dysarthria, which is difficulty in speaking caused by paralysis of the muscle responsible for the producing speech. Okay, another symptom such as dysphasia or aphasia, which is impaired speech and loss of the speech. And apraxia is an ability to perform a previous learned action. For the cognitive deficit, patient might have a short and long-term memory loss, decreased attention span, impaired ability to concentrate, poor abstract reasoning, and altered judgment. And for the emotional deficit, patient might have loss of self-control, emotional liability, decreased tolerance of stressful situation, depression, withdrawal, fear, hostility and anger, feeling of isolations. Okay, the doctor might do the diagnostic test to confirm the stroke. Okay, so among the diagnostic tests that doctor will do is a computed tomography. Okay. Okay, this computed tomography or CT scan to do we will do to determine the presence of the hemorrhage, tumor, aneurysm, ischemia, edema, and tissue necrosis. Okay, other than that is the 12-lead electrocardiogram or ECG to identify the source of the thrombus or emboli. Okay, another is a carotid ultrasound, CT angiography, magnetic resonance imaging and angiography, which is MRI and MRA of the brain and neck vessel, transcranial ultrasound Doppler, cerebral angiography, and the lumbar puncture. Okay, we move to the treatment. Treatment for the ischemic stroke ischemic stroke, normally we will give to thrombolytic drugs, okay? Fibrinolytic therapy, which is tissue plasminogen activations, anticoagulant drugs, antihypertensive drug, angiotensin converting enzyme inhibitor, diuretic, and anticonvulsant agents. Okay, for the thrombolytic drugs, okay, we used to treat ischemic stroke by dissolving the blood clot that is blocking blood flow to the brain. Okay, the example of the drugs such as aspirin, ticlodipine, okay. And for the anticoagulant drug, we use to prevent further extension of the clot and formation of the new clot for ischemic stroke. Okay, the example of the drugs such as heparin or warfarin. Management of the ischemic stroke. Okay, normally we maintain the cerebral hemodynamic, which is we want to prevent the increased intracranial pressure from the brain edema, and associated complication may occur after leakage is large ischemic stroke. So our intervention to reduce intracranial pressure is administering an osmotic diuretic such as mannitol, maintaining the partial pressure of the carbon dioxide within the 30 to 35 millimeter mercury, elevation of the head of the bed, and intubation with an ETT tube for the patients. Patient will continue with the hemodynamic monitoring and neurological assessment. For the hemorrhagic stroke, okay, patient will treat with the antihypertensive drug, angiotensin converting enzyme or SE inhibitor, diuretic, anticonvulsant agent, and analgesics. For the management of the hemorrhagic stroke, patient will put on the bed rest with the sedation because we want to prevent agitation and stress, because agitation and stress will increase the intracranial pressure for the patients. Okay, and patient will give FFP and vitamin K. Okay, may be given if bleeding is caused by the anticoagulant. Anticonvulsant agent are administered prophylactically. Analgesic may be prescribed for the head and neck pain. Anti-embolism stocking to prevent deep vein thrombosis. Antipyretic to treat fever, and antihypertensive to decrease risk of another intracerebral hemorrhage. If the medically treatment is not improved, so patient might suggest for the surgical management. So for surgical management for ischemic stroke, there is a two surgery that patient will go through, which is carotid endarterectomy and carotid stenting with or without angioplasty. For the hemorrhagic stroke, patient will go for the surgical evacuation via craniotomy. Okay, this is the carotid endarterectomy, which is there is an incision is made to open the carotid artery, and then the plug is removed, then the vessel is repaired and the artery is closed. Okay. Okay, for the nursing assessment for the patient with the stroke, okay, we will do the complete neurology assessment and evaluation for the following. First, we have to monitor for the altered level of consciousness. Okay, and then we monitor for the sluggish pupillary reactions, motor and sensory dysfunction, cranial nerve deficit or ocular eye movement, facial drop, and presence of ptosis. Okay, you can see the eyes is dropped. Okay, this is a ptosis. Speech difficulty in visual disturbance. Okay, patient unable to speak well. headache and knuckle rigidity or other neurologic deficit. Knuckle rigidity is a neck stiffness for the patients. Okay, now we move to the rehabilitation in stroke. Okay, there is a few goals for the patient for the rehabilitation. First, we want to reduce dependence and improve physical ability. Okay, as before patient having a stroke. Improving mobility and preventing joint deformities. That's mean we want to prevent all the body from the contractures. Enhancing self-care. That's mean patient able to do their daily activity by their own as before they having a stroke. Okay, decreasing confusions, achieving a form of communications, maintaining skin integrity because patient with stroke normally unable to move, so they will lie down in the bed. So the risk for the bed sore is very high. Okay, and prevent of the complications. Okay, there is three things we consider in the rehabilitation for the patient with the stroke. First is a physical therapy, which is we want to prevent contractures and improve muscle strength and coordinations because patient with the stroke is unable to balance and unable to coordinate themselves. Okay. For the occupational therapy, we want to provide assistive device and plan for regaining lost motor skill that greatly improve quality of life after the stroke. Okay, that's mean patient able to do their own routine. Okay, such as bathing, eating. Okay, and then for the speech therapy, we want to help the patient relearn language and communication skill as well as improving swallowing. Okay, when we want to start rehabilitation. Okay, rehabilitative therapy typically begins in the acute care hospital once the condition has stabilized, often within 48 hours after the stroke attack. The first step often involves promoting independent movement to overcome any paralysis or weakness. Okay, so we want to encourage patient, okay, to move by their own. Okay. Okay, from that, I noticed there is a few nursing diagnosis for the patients with the stroke. Okay, which is impaired physical mobility related to hemiparesis, loss of balance and coordination, spasticity and brain injury. The number 2 is the self-care deficit, bathing, hygiene, toileting, dressing, feeding, related to impaired mobility and mental confusions, impaired verbal communication related to brain damage, impaired swallowing related to weakness or lack of coordination of the tongue and deficit in swallowing reflex, and ineffective tissue perfusion or cerebral related to bleeding or vasospasm. And the last one is specifically for the patient with the hemorrhagic stroke. Okay. Okay, we move for the nursing care for all the nursing diagnosis. For the impaired physical mobility, first we want to encourage patient to do the active range of motion exercise for the unaffected extremities and perform range of motion exercise for the affected extremities. That's mean if patient having a stroke in the right hand, so active exercise for the left hand, left side, and passive exercise for the side. Active and passive exercise maintain and improve muscle strength and endurance and help in maintaining cardiopulmonary functions. That's why we want patient to do the active and passive range of motion exercise. Okay, another one is a turn client every 2 hours and maintain body alignment and support extremities in proper position with the pillow. Because positioning maintain joint function and elevate pressure on bony prominence that lead to the screen breakdown. Okay, so we turn patient every 2 hours because we want to maintain the body alignment, and another cause we want to prevent from the skin breakdown. Monitor lower extremity for the manifestation of the thrombophlebitis because patient rest in bed, especially loss of muscle strength and tone, particularly prone to development of the deep vein thrombosis. And then maintain body alignment and support extremity in the proper position with the pillow, and calibrate with the physical therapist as patient gains mobility using consistent technique to move the patient from the bed to the wheelchair and help the patient ambulate. Okay, because the use of consistent technique facilitates rehabilitations. For the self-care deficit, okay, we screen for the executive cognitive dysfunctions such as abstract thoughts, action plan, and adaptation to the unexpected. Because this assessment is essential to helping a patient remain as safe and independent as possible. And then we encourage patient to use the unaffected arm to bath, brush teeth, comb hair, dress, and eat, because it can promote functional ability and independence to the patients. Teach the patient to put on clothing by first dressing the affected extremities and then the unaffected extremities, because this technique facilitates self-dressing with the minimal assistance. So patient will feel they able to do by their own. Okay. And calibrate with the occupational therapist in scheduling times for training for upper extremity functioning necessary for activity of daily living. Because regular schedule in daily routine promote learning, use of assistive device, promote independent and decrease feeling of the powerlessness. Okay. Okay, the third nursing diagnosis is the impaired verbal communication. So our intervention is assess the communication needs, describe the precise deficit, and suggest the best overall method of communications. Because we want to determine the specific nature of impairment when planning interventions and helping family member understand the specific problem. Okay, we have to know what are the patient's need. Okay, and plan interventions to meet communication needs such as approach and teach the patient as an adult. Okay, we communicate with the patient like usual. Okay, do not assume that the patient who does not respond to respond back to us. Okay. And do not raise a voice when addressing the patients, okay? Because patient can hear you. So you no need to raise your voice. Allow adequate time for the patient to respond, okay? So we give it a patient time so they can respond back to us what are their needs, okay? Face the patient and speak slowly, okay? When you talk to the patient, please face the patients, okay? So that sometimes they can read your lips, okay? Speech be honest and say so when do not understand the patient's speech. When you cannot understand, you have to tell the patient, okay? And use short, simple statement and questions so that patient able to understand well, okay? Because all this intervention will accepting the patient and providing dignity and respect enhance the nurse-patient relationship. And then you have to accept frustrations and anger as a normal reaction to the loss of the functions. Okay, because anger represents the patient frustrations at the inability to control the lost function. Try alternate method of communication such as writing tablet, flashcard, and computerized talking board. Okay, this is the another way to talk or to communicate with the patients. Because different method patient can sometimes some patient can understand with a different method. Okay, patient unable to communicate verbally may use other method effectively. Okay, for the fourth nursing diagnosis is the impaired swallowing. Okay, so patient who have having impaired swallowing, we have to monitor result also swallowing studies. Okay, and swallowing study often conducted by the physical therapist prior to providing oral food and fluids. Okay, and when eating, do not follow to do the following to avoid aspiration and ensure patient safety, such as position in the upright sitting positions, okay, or the blend diet or soft diet, okay, so that the food become easy to digest. Feed or teach patient to eat by putting food behind the front teeth on the unaffected side of the mouth and tilting the head slight to the backward. Teach patient to swallow once bite at a time and assess for the coughing with the eating or drinking and have suction equipment available at the bedside in case of choking aspirations. For the last is infective tissue perfusion. This nursing diagnosis is specifically for the patient with the hemorrhagic stroke. So our intervention is to monitor respiratory status, saturation oxygen, and airway patency, auscultate pulmonary sounds, and monitor respiratory rate and result of the arterial blood gases. Because this patient may unconscious and impact the breathing. So through the monitor the respiratory status, we know whether the patient is having difficulty in breathing or not. Okay. Okay, suction if necessary because we want to remove secretion that obstruct airflow and decrease the oxygen. Place in the side of the lying position, okay, so that any secretion or phlegm, okay, can we can flow that the and prevent from the aspirations. Okay, administer oxygen as prescribed. Okay, because we want to decrease the risk for hypoxia and hypercapnia, which can increase cerebral ischemia and intracranial pressure. Monitor mental status, level of consciousness, restless, drowsiness, lethargy, inability to follow command, and unresponsive. Because this changes mental status, loss of consciousness are often initial manifestation of increased intracranial pressure. And assess for the pain, headache, decreased muscle strength, sluggish, pupillary reflex, absent gag or swallowing reflex, hemiplegia, cerebrate, and decorticate posturing. Okay, so because alteration in the mental status, loss of consciousness, movement, strength, and reflex indicate increased intracranial pressure that major cause of death in the acute phase. Continuously monitor cardiac status, observing for the dysarrhythmias, okay, because stroke can cause cardiac dysarrhythmias, including bradycardia, tachycardia, and AV block, atrial fibrillation block. Okay. And monitor body temperature maintained at 37 degrees Celsius during acute phase, because fever was constantly found to be associated with the worst outcome in the patient with the stroke. And lastly, maintain accurate intake and output record, because we want to measure the urine output. Okay. Stroke may damage the pituitary gland, resulting in diabetes and the possibility of dehydration from the greatly increased urinary output. Okay, I think that's all about my lectures. Okay, this is my reference. Thank you very
Okay.
much.
Okay, thank you very much, Miss Kasim, Miss Mazriana, MD Kasim, for very, very insightful material this morning of your guest lecture. Okay, well, now it's the time for question and answer sessions or discussion, Miss Kasim. And on the chat Zoom, I saw some question regarding the topic. For the first question, okay, let me read the question. Question number 1 is from Ibu Iksora. She would like to know what is the common implementation in Malaysia. I mean, and then especially for rehabilitation phase, during the rehabilitation phase, maybe you can give us a real example. I think maybe in at home, of such kind of home care, or maybe in the hospital.
Okay. In Malaysia, normally patient will keep in the hospital first, okay, until patient is stable, and then is allowed to discharge to the home. And when at home, okay, normally patients will take care by their own family members. But before they discharge, we teach them everything about the care of patient with the stroke. Okay, such as about about their daily activity of living, about their medications, about their exercise, about their diet. Okay, all that we teach them first before they discharge, and then patient will come after might be a month after that for the follow up, and the most important thing is patient have to do physiotherapy. We refer them to the physiotherapy, okay, to make sure they are able to gain back their own strength, they can functional back, such as before they have a attack.
Okay, so to sum up, jadi ada dua.
Yeah.
Yang pertama in the hospital,
Yeah.
diberi health education, and then in terms of berkaitan dengan daily activities, berkaitan dengan medication, pengobatan, kemudian berkaitan dengan exercises, latihan-latihannya physically, and then also the diet, makanannya nanti seperti apa, semuanya diajarkan kepada family atau keluarganya. And then after that, there will be a follow up in a month. Ada follow up setelah 1 bulan. Dipastikan sebelum discharge dari hospital, keluar dari rumah sakit, harus ada health education dulu kepada family-nya. Kemudian untuk memastikan follow up, there will be a physiotherapy also, untuk memastikan, to ensure that the patient able to gain back their strength, something like that.
Yeah.
Okay.
So we most focus on the treating physical activity, occupational therapy, and the speech therapy, because that one is fundamental for us, right? So we more focus on that three things.
Okay, I see. So the three important thing, tiga hal pentingnya adalah untuk terapi fisikal,
Yeah.
kemudian speech berkaitan dengan cara bicaranya, and then occupational therapy. Thank you very much, Miss Kasim. And I hope it can answer the question of Bu Iksara. Now we move to the second question. Renata Eka, maybe you want to ask directly to the lecturer today. Renata, please turn on your microphone. Okay, come on, Renata. Maybe you would like to ask directly to Miss Mazriana Kasim your own question. Please turn on your microphone.
Excuse me, my name is Renata, and I would like someone is having a stroke, and why is it important to get to the hospital as quickly as possible? Thank you so much.
Okay. As we know, stroke can cause disability and mortality. Okay. So that's why patient with stroke is very important. Once you know patient is having a stroke, you have to admit patient to the ward. Okay. So that you can monitor and give the treatment for the patients. Okay. To reduce the chances to get the maksudnya macam kesan yang lebih teruk kepada pesakit. Okay. And then we don't want patient to death. Okay. That's why we have to treat patient emergency. Okay. You cannot let patient in the house or what. Okay. Because we don't know. And then some stroke, as you know, there is a two type of stroke, which is ischemic and hemorrhagic. Okay, the two type can cause disability and mortality if we not treated well and dalam jangka masa yang cepat. Okay, so pesakit boleh meninggal ataupun boleh mengalami kecacatan yang teruk jika tidak dirawat secepat mungkin.
Okay, I see. So the time is very important key here.
Yeah.
To decide the best treatment. If it is apakah is it ischemic or hemorrhagic?
Hemorrhagic, yeah.
To prevent disability, kecacatan, or
And
bahkan the
mortality.
death or mortality, kematian.
Yeah.
Okay. Thank you very much, Miss Mazriana. And now we go on to the next question. Dear Ayu, would you please deliver your question directly to Miss Kaka? She would like to know about special treatment. Maybe in Malaysia, there is a special treatment. This is, I think, regarding the first question of Wibu Iksora. So maybe Ms. Kasim, you can tell us, maybe there is a special treatment for stroke patient that maybe do not implement in another country, something like that. So the treatment can help the patients gaining their strength. Like
okay, if we look at Malaysians, the most important thing is rehabilitation after the attack. Okay, that's why I'm stated that the rehabilitation as early as 48 hours of the attack. That means we cannot let patients orang kata dalam keadaan yang stroke tu berpanjangan. And then dia punya proses rehabilitation tu akan mengambil masa yang very long. Okay, and patients and family have to commit with their treatment and the process of rehabilitation itself. So Kalau di Malaysia untuk nak kata ada special treatment tu, saya rasa most of the treatment lebih kurang sama.
Okay,
Cuma
I see.
ya, cuma yang kita pentingkan adalah kita nak tahu pesakit tu able to function or not as sebelum dia kena serangan. Okay, sebab sometimes patient need go back to the work kan. Patient needs go back if she is a wife, so the role and their function tu must come back. Okay, that's why we want to as early as possible they can start their rehabilitations.
Okay, I see. So maybe the treatment commonly the same in Malaysia and also another country.
Yeah.
But the one important thing, satu hal yang penting adalah untuk memastikan bahwa pasien ini bisa kembali lagi mengerjakan seperti yang sebelum dia terkena serangan, seperti like that,
Yeah,
Bapak Ibu
betul.
dan juga
Yeah.
mahasiswa. Jadi ada komitmen between the nurses or maybe the healthcare providers and also the patient and family to help the patient getting back their strength. So then, for example, ketika mereka sebelumnya bisa bekerja, pasca
Yeah.
serangan stroke, mereka bisa bekerja kembali.
Yeah, betul.
Ini salah satu one of the indicator that the treatment and rehabilitation are successful, something like that.
Yeah.
Yeah. Okay,
Sebab di
thank you.
Malaysia memang ada case yang di mana patient stroke, okay, can go back to their normal life back.
Oh yeah.
In fact,
Okay,
dia kena commit lah with that rehabilitation phase tu during the rehabilitation.
Okay, thank you very much, Mas Riana Kasim. Now we go on to the next question. In the phase of rehabilitation, there is a question from Pak Edi Yuswantoro, one of the lecturer in Poltekkes Kemenkes Malang. In the phase of rehabilitation, what is exactly the expectation from the family to the patient?
Okay, normally kalau we can see patient family of course one patient can gain their own back life kan.
Yeah.
So untuk pastikan pesakit to able to gain their own life balik, so the family have to cooperate. Family have to help patients. Okay, even not they do fully for the patient, macam in the bathing, in the toileting. So we don't do all for the patients, but we assist patients. Okay, that's why we have to teach family members also, so that when they go back to the home, okay, family know what to do, okay, during patients in the house. Okay.
Okay. Jadi Pak Edi, harapan dari keluarga itu adalah bisa kembali membantu pasien untuk mendapatkan kembali kemampuan awalnya begitu. Misalnya saja contoh sederhana for the simple, for the example is helping the patient with bathing, cara mandi, and then toileting ketika harus ke toilet, or maybe the very simple, the simplest is something like combing their hair, menyisir rambut mereka sendiri without any assistance from the family. One of the
That's why before we discharge with the for the patients, okay, normally we call it family member also.
Oke, jadi sebelum discharge, sebelum keluar dari rumah sakit, pihak rumah sakit biasanya memanggil keluarga untuk dijelaskan secara lebih detail bagaimana menolong pasiennya nanti ketika di rumah begitu, sehingga bisa membantu lebih maksimal. Thank you very much, Ms. Kasim, for the explanation. Thank you, Pak Edi. And now the next question from Aldila Putra. Ms. Mazriana, would you please explain how to treat stroke post-hospital or something like home care stroke in Malaysia? And How about the policy of the Kingdom of Malaysia regarding other dealing with the financial issue, something like that?
Okay, normally memang kalau dekat patient post stroke dia akan balik kan. Dia she's not long stay in the ward. Okay, once patient balik tu, so kita akan treat, and sometimes kita boleh rujuk kepada certain persatuan. Okay, di Malaysia kita ada persatuan untuk stroke patients.
Okay,
So
ada
we can refer patients to that persatuan, so that di sana mereka akan lebih diajar, they can learn from the other patients stroke yang lain, so that itu orang kata boleh it help patients in their rehabilitation process. Okay, so far di Malaysia memang about finance kita tak ada directly finance for the stroke patients. But in the hospital, if we know patient is having a financial problem, okay, so hospital try to bantu, not sepenuhnya, but sometimes we just help with the assistive device. Okay, we help patient to buy assistive device, sebab kadang-kadang kan dia not orang kata tak boleh bergerak sepenuhnya kan, so dia perlukan assistive device. So macam tu yang kita bantu pesakit. Kita not fund with the money or what, no, but we help patient. If patient needs device or something else, or we help them to get that device, only like that.
Okay, thank you. Thank you very much for the explanation. So there is no policy about the financial problem in Malaysia, but maybe if the hospital would like to help the patient, it is possible, but in their own way, seperti itu. Kemudian untuk home care stroke-nya, I think it's the same as the previous explanation, hampir sama dengan penjelasan sebelumnya ya, Aldila, bahwa penekanannya sebelumnya harus ada education, health education to the family untuk diperhatikan nanti saat di rumah. Dan di Malaysia ada persatuan. It means like a community, Miss Mazriana?
Yes, community.
Okay, I see. The community of the stroke patient. Jadi misalnya ada mungkin something problem, maybe a problems dealing with the patient, they can refer, bisa dirujuk begitu to the community of stroke patient untuk mendapatkan mungkin treatment atau advice suggestion regarding to the rehabilitation. Thank you very much, Miss Mazriana. Okay, we have a raised hand on Zoom. Ibu Rahayu Nenengase, please you can deliver the question directly to Miss Mazriana Kasim.
Yang paling akhir saja setelah itu yang masih ada satu pertanyaan.
Okay, I see. We go on to the Zoom chat room first, Miss Mazriana. From Ibu Elok Yulidaningsih, she would like to know about stroke in Malaysia, if whether is there special psychological treatment to prevent anxiety or depression for stroke patients, ma'am.
Okay, in Malaysia, normally we can refer stroke is the stressful event, right? So patient memang akan ada emotional disturbance. Okay, so before patient discuss, and we call counselor. We call counselor to give advice to the patient so that they can have a emotional support. Okay, together with the family. Okay, so masa tu kita akan panggil counselor untuk advice diorang, untuk bagi sokongan emosi. Okay, together. Sometimes doctor will join also patient during the session. Okay, sebab we want to know what is the exactly problem when patient go back to the house. Okay, such as facility di rumah kan. So kita akan kata apa, dari segi emotionally, and kita akan ambil tahu hal itu, so that we can refer them to mana-mana jabatan yang boleh membantu pesakit. Okay, dari segi emotionally memang kita akan refer kepada counselor lah untuk untuk dia orang kata apa release their stress or anxiety macam tu. Okay, Madam Yuyun, I can't hear you.
Oh, I'm sorry, I'm muted. I'm sorry, Miss Mazriana. Okay, well,
Yeah.
according to Miss Mazriana Kasim, for psychological treatment to prevent anxiety, we can call counselor or maybe consultant begitu to give some advice, memberi saran to the family and also the patient, because who experience anxiety, I think not only the patient itself,
Yeah,
Miss
family
Mazriana, but also the family. And this
That's why
is
we
such
call
a
it
very
them together to discuss.
yes. Okay. Nanti di sesi konsultasi ini, the doctor can join also, Ibu Elo dan juga partisipan lainnya. Jadi ada dokter yang bisa join di dalam sesi counseling ini untuk memberikan, untuk sehingga pasien atau family bisa menceritakan begitu, to release what they feel, what they experience during the rehabilitation phase, and then emotionally, secara emosional nanti bisa tersampaikan dan they can give some advice to both of them, family and the patient.
Yeah.
Okay, thank you very much, Miss Mazriana. Okay, well, Ibu Rahayuni Nengasih, now maybe you want to ask directly to Miss Mazriana, you can turn on the microphone.
I'm sorry, I'm not speaking English.
It's okay, ma'am. Maybe you can use Indonesian language because Miss Mazriana, I think, understand enough about the Indonesian language.
we can use dual language.
Yeah, dual language. Yeah.
Post hospitalisasi patient stroke, of course, follow up care at home.
Yeah.
Maybe as in Malaysia, ordination, family, public health center, maybe university with nursing students. Apakah memang ada koordinasi, kemudian semacam kerjasama yang bisa dikerjakan?
Okay.
boleh repeat balik tak?
Yeah.
Actually, I'm not really clear.
Yes, let me translate Ibu Rahayu questions to you, Miss Mazriana.
Yeah.
So she would like to know apakah ada misalnya if in Malaysia there is a cooperation among three there is a cooperation among the university of nursing faculty maybe, and then the public health center, and then to the family or the patient. So to help the patient optimally gaining their strength back, something like to help the patient getting the recovery. Maybe there is a cooperation with the university and also the public health center, or maybe coordination among them.
Oh, okay. Dia macam ni, di Malaysia kita ada hospital under government and hospital under university. Macam tu.
Okay, I see.
So normally government hospital and university hospital ni sentiasa integrate lah. They standardize their treatment, dia orang punya perawatan semua. Tapi cuma kalau daripada nursing department sendiri kita tak adalah orang kata apa, directly to the patient. So dia melibatkan di hospital macam tu. Sebab kalau nursing department di university, only in the university. So kalau yang melibatkan nursing adalah most of the jururawat saja di dalam hospital yang akan dealing directly with the patients. Macam tu.
Jadi ada hospital di bawah university, ada juga hospital di bawah naungan pemerintah. Dan biasanya kalau universitas yang jurusan keperawatan itu kontribusinya kepada hospitalnya, tidak langsung kepada pasiennya, begitu Bu
Ya,
Rahayu?
betul.
Tidak langsung kepada pasiennya. Jadi nanti yang kepada pasien itu juru rawat yang ada di hospital. Maybe university has the contribution like maybe about suggestion something like that to the nurses in the hospital. In what extent? I mean, Miss Mazriana.
Okay, cuma macam ni, if patient tu need betul-betul contohnya macam rehabilitation yang ni, so hospital government tu dia akan refer patient to the university hospital sebab mostly university hospital ni dia memang ada all the pakar.
The
pakar
expert.
dia memang ada sebab dia teaching hospital kan. Yeah, they have many expert. Okay. So patient akan di refer ke hospital university untuk dapatkan
more treatment.
More treatment macam tu. Sebab university dia more wide dia punya service tu. Sebab they have all the expertise there. Kalau di university, yes, mungkin akan ada we call it as a clinical specialist nurse di hospital university. So hospital clinical specialist nurse ni dia direct, even not dia bukan nurse biasa lah. That means dia adalah expertise dalam sesuatu bidang macam tu. So kalau di hospital pengajar kita memang akan ada clinical specialist nurse kita panggil. So clinical CNS ni dia akan work directly with the patient. Macam tu.
Okay. Jadi
hanya di university hospital saja.
Ya, okay. I see. Thank you. Jadi kontribusinya itu biasanya kalau misalnya ada pasien yang di rumah sakit, nanti bisa diarahkan untuk mendapatkan perawatan yang lebih baik lagi di hospital di university, karena di hospital university itu memiliki ahli-ahli yang lebih ahli-ahli dalam bidang-bidang tertentu, for example berkaitan dengan rehabilitation for stroke patient, sehingga bisa mendapatkan treatment yang lebih banyak atau
lebih
mungkin better treatment di hospital. Begitu Bu. Ibu
Even
Rahayu?
in Malaysia we have one hospital specifically for the stroke patient, which is Hospital Pengajar University Putra Malaysia. Kita panggil.
University. Would you please repeat once again, Mas Riana?
Hospital Pengajar University Putra Malaysia.
Hospital
that
Pengajar.
hospital memang specialized for the stroke patient. Hospital Pengajar University Putra Malaysia. Malaysia.
I see. Hospital Pengajar University Putra Malaysia.
Yes.
This is
that hospital like macam center rujukan kepada semua patient stroke.
I
Rujuk
see.
di situ.
Okay, I see. So this is one of the hospital specialty in stroke cases. Okay. Hospital Pengajar University Putra Malaysia. Thank you very much for very useful
Ini kayak rumah sakit
information.
pendidikan.
I see.
Itu rumah sakit pendidikan punya.
Rumah sakit pendidikan. Okay. Thank you very much for your information, Ibu Mazriana Kasim. Okay, we have one more question, Ibu. From Pak Awan, what are the limits of nurse in Malaysia in administering the drugs for stroke patient ini ya Pak Awan ya? What are the limitation? Maybe there is a term and condition, something like that, for the nurses in Malaysia in administering the medication to stroke patient.
Okay, actually in Malaysia kita cuma tak boleh prescribe the drug. Maksudnya prescription of the drug only doctor. Okay. Tapi kita can administer the drug. Tak kisah I am through the intramuscular ke intravenous ke, we can give to the patient. Only we cannot do is to prescribe the drug for the patients. The drug must come from the doctor.
Jadi
itu sahaja yang kita tak boleh.
Ya, jadi Pak Wan untuk itu resep obat itu langsung menjadi wewenang dari dokternya. Kalau untuk nurse-nya, perawatnya itu hanya untuk memberikan mengadministrasi saja pengobatan yang diresepkan itu kepada pasien. For example, maybe this is the medication for the patient. Nanti perawat yang akan mendistribusikannya kepada pasien. For example, IV, using IV intravenous medication, something like that. Pak Awan?
Okay,
Is it
thank you.
answering your question? Okay, thank you very much.
Is it
Pak
same
Awan.
dengan Indonesia? Sama?
Sama-sama.
Sama kan?
Is it the same? This is the
Yeah.
same. Thank you. Okay. Well, dear all participants, maybe do you have any other questions to Miss Mazriana Kasim? Maybe you can raise your hand, or maybe you can type the question on the chat Zoom. Okay, if there is no questions or discussion anymore, I think
Mungkin saya, Ma'am Yun.
Ya, silakan Pak Krisa.
Ya.
Terlihat keterpental. Silakan.
Yun, like, ya.
Yeah. I can hear Mbak Yuyun.
Oh ya,
Miss Yuyun.
Ma'am Yun. Ma'am, ini bahasa Indonesia aja ya. Kalau di Malaysia ada nggak apa relawan gitu? Relawan atau
Relawan.
iya partisipasi dari masyarakat terhadap ini masalah stroke di komunitas.
Oh, specifically sukarelawan tu tak ada, tapi di hospital memang kita adalah yang membantu. Selalunya macam saya cakap, in the community dia ada persatuan dia sendiri. So persatuan stroke tu memang ada di Malaysia, and then kita boleh hospital can refer to the persatuan untuk selanjutnya perawatannya itu. Tapi nak kata kalau macam individual punya sukarelawan, tak adalah. Kita tak ada individual punya sukarelawan. They form in the persatuan macam tu.
Terima kasih.
I'm sorry, I lost my connection, Miss Mazriana. I'm really sorry.
Yeah. Because I know. Sebab I punya my internet also not very stable here.
Yes.
Yeah.
Much for session. Well, dear participants, is there any questions or discussion? Okay, no. Well, I think that's our question and answer session, Ms. Mazriana Kasim. Thank you very much for very, very insightful and fruitful information regarding the topic nursing care for stroke patients during the rehabilitation phase. And to sum up your materials today, there are two types of stroke. Number one is ischemic, and then number two is hemorrhagic stroke. And both of them have a different treatment and management to help the patient gaining their strength back and to get the full recovery to prevent the disability and also the mortality or death effect, something like that. And one of the important thing here dealing with the problem of stroke cases is the time. Time is a very important key to help the patient preventing the disability and mortality. And during the rehabilitation phase, it is important to pay attention to the three therapy. Number one is psychological therapy, and the number two is occupational therapy, and the last therapy is dealing with the
Communication.
yes.
Communication.
Okay. Well, dear participants, today, thank you very much for joining our international guest lecture. Thank you very much once again to the keynote speaker today, Ms. Mazriana Binti MD Kasim, Master of Nursing. Thank you very much for your insightful and useful information today. And now the time for closing. Let's give it back to the Master of Ceremony, Renata Eka. The screen is yours. Thank you very much, everyone. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you.
Renata, you are still muted.
Thank you very much, Bu Yuyun. Well, ladies and gentlemen, before closing the meeting today, let's have virtual photo session first. So, please turn on your video of Zoom and let me count from slide number 1. Okay, 1, 2, 3. Let me continue to the next slide. 1, 2, 3. 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 And the last slide. 1, 2, 3. Okay, ladies and gentlemen, that's all the guest lecture today. We hope that we found everything useful to add up and upgrade our knowledge regarding the nursing science. And last but not least, special thanks go to the keynote speakers and all participants today. Please accept our apology if there were any mistakes we made. Well, Bapak, Ibu, and dearest participants, that's all guest lecture today. Bye for now and see you on the next program. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Mazriana Kasih.
Waalaikumsalam. Thank you, everyone.
Thank you.
Nice to meet you all. Bye.
Thank you. Goodbye. See you.
Bye-bye.
See you. Ditunggu ke Indonesia, Cikgu.
Ya, insya Allah, insya Allah. Thank you.